By show of hands, how many of you here today are going to die?
A series of meetings is being held on Hawaii Island about death with dignity as the Our Care, Our Choice Act goes into effect in just a few months.
It's why it's so important to talk to your doctor and make sure your doctor and your whole care staff that they know what you want.
The conference room was full at the Hilo Aging and Disability Resource Center on October 24th for a presentation by Compassion and Choices Hawaii.
We call it the Access Campaign. Compassion and Choices, we work to help states pass these laws, and then we stick around to make sure people have access to it.
They are the local affiliate for the nonprofit organization committed to improving care and expanding choice at the end of life.
We want to make sure that everyone who's qualified has the option.
The free presentation, also delivered in Kona and Waimea,
Talk to a pharmacist who's prescribed before,
intended to help everyone understand and prepare for implementation of the Our Care, Our Choice
a
Act,
prescription,
the new law that authorizes medical aid in dying.
to self-administer to bring about a peaceful death. By law, medical aid in dying is not considered suicide, assisted suicide, homicide, or euthanasia.
Access Campaign Director Samantha Trad explained the details.
Medical aid in dying eligibility criteria. So as I said, you have to be an adult, at least 18 years or older. You need to be terminally ill, and you need to have a prognosis of 6 months or less to live, and you need to be mentally capable of making informed medical decisions. A patient must make 2 verbal requests separated by 20 days and 1 written request which can be submitted at any time. So there is a waiting period. The fastest a person could receive a prescription for medical aid in dying is 20 days. And that is if you have all your ducks lined up in a row.
Trad also played an emotional video documenting an end-of-life experience for one terminally ill patient.
It's a beautiful video.
After the presentation, audience members had questions.
Being on the outer islands, I think we do suffer the issue of isolation.
Many expressed concerns about implementation on the Big Island.
I know there's a shortage of physicians as well in Hawaii too, I've read in the newspaper, and that's why being educated is so important.
East Hawaii palliative care providers were also on hand.
Kaku Mau is here, Lori Miller, and we have been talking to them, and they're very aware of the law. Do you want to say anything?
This is the executive director of Kauai Hospice, but I also serve as the president of Kokua Mau, which is the state hospice and palliative care organization. And we have been very involved in understanding how this law has, how this legislation has become law, and working with our members to understand what position we would take as a member organization, because our member organizations are quite diverse and representative of places like Catholic hospitals and health insurance carriers.
Hawaii Care Choices, which is the East Hawaii Hospice and Palliative Care Organization, would always support whatever our patients, they have options, multiple options.
Lauren Kim with the Hawaii Department of Health was also in attendance.
The bill we have is something, it wasn't there before, and the form it was passed was enough to get passed. That's what we have to recognize, and I have the constitutional authority to implement the law as it's written.
The presentation was coordinated by the Hawaii County Office of Aging, State Senators Lorraine Inouye and Russell Ruderman, and State Representatives Cindy Evans and Joy San Buenaventura.
In 2000, when Senator Inouye was in, it died in the Senate by 2 votes. This time around, it died in the House the year before and we killed the Senate bill because we didn't believe it had enough safeguards. So, like Senator Inouye said, I know it is going to be more difficult for the patient itself, but we ask for your patience. We want to make sure it works.
The Our Care, Our Choice Act goes into effect on January 1st, 2019.
Most people, of course, want a peaceful death.